Is it crazy or autocracy? Or what type of crazy is that? Except crazy.
News making the headlines.
Black Maria is to carry criminals, trading looters that are in government today.
Sometimes it gets confrontational.
Slap you in the face.
Excuse me, don't put words into my mouth.
Whatever it is that will bring our military to the Shiput, I said to hell
On
with it.
Core Digest,
I want to know why I should be believing them.
every weekday, we'll bring all of these together and take them to the court of public opinion.
Everybody have your right in Nigeria.
Where you are the judge.
Hello and welcome back. You're still on to Core TV News in Lagos and you're watching Core Digest, our steamy breakfast participatory program. And it is time for our teaming viewers and callers within and outside Nigeria to participate by joining us on the topic of discussion, which is Lassa fever outbreak. How prepared are we? And I still have with me in the studios Dr. SEGUN AKINWOTU, who is the second vice chairman of the Nigerian Medical Association, Lagos branch, and also a registrar with the Neuropsychiatric Hospital in Yaba, Lagos. Don't forget that Lassa fever, as he's explained, affects virtually all the sensory organs, breaking them down completely. And that's why conjunctivitis is one of them, and a lot of hemorrhage here and there. Within, outside the nostrils, the skins, the stools, the urine, and the rest. So the number to call to join us, it's a new number. It's +234 for those outside Nigeria, and the local number is 0816 481 8001. It's right on your screen. If you check, you're going to find that. But I'll take it again. +2341 for international callers and 0816 481 8001. Call us and be part of our discussion. Doctor, the campaign, like I said, how much support are we really getting from international agencies like the World Health Organization? We have seen here that research is still ongoing, to find good prognosis in having a vaccine that is curative, away from the ribavirin now. And they say a lot of successes has been recorded, on tests on animals so far.
Animal experiments. There's it's a pandemic right now that is not just even in Nigeria.
In Nigeria, yeah.
Affecting some other West African countries.
Absolutely.
It's a pandemic in West Africa, really. And then it's a source of worry for the United Nations. That's the WHO arm of the United Nations. So there is full support in terms of collaboration with our Federal Ministry of Health. And then also there are United Nations agencies that are actually working with the states governments to ensure that proper measures are instituted to ensure that there is adequate knowledge, information dissemination to the people, and that whenever cases are suspected, they are immediately isolated, and then surveillance for contacts, those they had contacts with, is whoever
particularly in the rural areas,
yes.
They are the more mostly affected. Yeah.
So when those who have been suspected are being isolated, then the contacts they had are observed for the incubation period of a week to 3 weeks, and once symptoms are not developed, they keep eyes off them. That shows nothing has happened. There's been no transmission from that contact they had. They are isolated between them. So that is as regards that. And Federal Ministry of Health in Nigeria has released a lot of statements through various means. They've had their full page adverts.
Yeah, even had collaboration, addressed the joint press conference with the Minister of Information. Yeah.
And then they've also gone to the National Assembly, who was invited, and I thought that was another means
to disseminating the information and reporting
and
it. Yeah.
Private discussion between the minister, the minister himself even having a press conference on it. So I'm sure a lot, is come out from there. And what's, like the system is such that there is proper alignment between the local government, the state government, and the federal government.
Fantastic, and that alignment is we're seeing it manifesting again tomorrow when they meet. I'm sure in Abuja, to further the action plans that they have. But I'm sure one area we have not touched is the probability. It's probably not a probability again, but pregnant women, getting infected with this virus. The fatality, like we all know, is quite high. When we have such cases, what is supposed to be done?
Well, especially during the third trimester, where the placenta is well developed, because the baby is getting nourishment from there, and as the baby gets bigger, the placenta gets more developed in the system. At that phase, it is very fatal, and the chances of the mother,
Surviving.
dying from that illness is high. So it's usually better to get the pregnancy terminated to ensure that the mother survives and she gets adequate treatment following that, so that she doesn't, get, because the illness would, even kill faster, let me put it that way, in her than compared to someone who is not pregnant. And then the fetus itself has 95% chance of passing on with fatality in that fetus. So what's now, the point?
So the child is not even safe too.
The child is not safe. Both the mother and the child are not safe. So that's why prevention is key. Prevention is very key.
So in an advanced pregnancy, say 7, 8 months, what medically would be done to carry out a cesarean in saving child and mother?
Well, cesarean can be planned, but it can also be, you induce the delivery.
Under that condition, you understand. Don't forget that the organ, that situation. That's what I'm looking at.
Sorry. Yeah. If the person actually has been tested to have,
been infected,
yes, there will be a collaboration between the medical team and the gynecological team. There are also other parameters
on what best to do.
Yes, there has to be that collaboration between the medical team and the gynecological team to determine what best to do, because each individual, sometimes there are some individual peculiarities that needs to be considered.
And some of these peculiarities could be maybe how advanced the virus is gone in the person.
No, apart from the virus, that's part of it, right? But there are some other individual peculiarities that, based on the history of the pregnancy.
Okay.
That's what I'm trying to say.
Okay.
Now determine what and how far best
to manage the patient. And work is in progress and is still continuing on the production of a multiple vaccine, to attack this pandemic, and the result seems to be encouraging in the sense that trial tests on animals, they usually say lesser animals, is quite encouraging.
Yes, there are trials. There are current drug development trials to get a vaccine that actually will take care of, protect us from Lassa fever. And mainly, most of these vaccines are preventive. And once the person has developed the antibodies against it, even when there is infection, the person is able to ward it off. Because what is seen is what is generally seen is antibodies that ordinarily meant to be developed by the person, that's within the person against the virus, usually
are weakened.
they are not even seen
Yeah.
in the early phase of the illness. That's what has made it a bit difficult to have developed these vaccines for a long time. But as we hear now, there's a lot of advanced work in getting something.
Is it being developed in Nigeria or abroad?
I can't really.
You don't have
really
information.
Say what they have. But what I was saying earlier about an advanced pregnancy, 8 months, that the pregnant woman got infected with the Lassa fever, I meant the delivery will be induced.
Yeah.
And what I mean, and when I say induced, the child is planned to be delivered.
Yeah.
I mean that pregnancy will be put to a halt, and the child kept, in an incubator, and the mother also properly managed. You understand? If
would the child have been infected? Is it most likely
most
likely of the
yes,
fetus?
yes,
the fetus is a breeding ground for the virus.
But if it's gone, if the illness itself is advanced, we can't predict the outcome. We can't really say either will survive. But if it's something that is detected early, at the face of this person is still having the sneezing, the headache, the fever, and it's caught at that point as it's Lassa fever, I'm sure some early intervention may promote the proper survival of the mother and the child.
Okay, proper survival for mother and child if the disease is detected early.
And intervention is early too.
Yeah, and intervention has to be early. The intervention here was quite slow in Nigeria. Just before I ask that question, if you're just joining us, you're still watching our breakfast program called Digest, and we've got a new telephone number for you to call, and you can call us on 234 for our international callers, and 0816 481 8001 for our local callers. It's Lassa fever outbreak. How prepared are we? I was just talking about the slow response to the situation we have at hand now. It wasn't, the news was not coordinated very fast. It was just like, it might just be one isolated case and the rest. But now it's gone past over 19 states as at the last count.
Well, we can't categorically say that intervention was slow, because when you have pockets, sporadic events, it wasn't as if it was the same primary source that actually got it disseminated to all the states. If you have sporadic sources in different states at the same time, what just happened was, as soon as that happened and information came, because as soon as that started coming up, we started getting, the news, and then we got the cases reported. And yes, we've had some cases that were fatal from it, but some of them that we felt were contacts and were suspected to have had it were actually quarantined and were being managed. Some passed on, but some are still receiving treatment. And for example, the one in Lut that got to Lut is in good
management.
Management. The patient is stable, and we're just waiting for the condition to run its course.
Okay.
And that's the only reported case in the States.
Okay.
Yeah, so it's I think that's adequate intervention as regards that.
Yeah, because it will really be
just that probably in those other states, I can't really say from here, but there may not have been adequate means, that is measures to sustain the management.
Yeah.
Now probably before it was detected that this actually is Lassa virus, the person had actually, because
it will really be explosive here in Lagos with the population of about 25 million people. You have such outbreak, you still have the issue of molars and the rest, people jamming themselves in public transportation.
Exactly. And talking about the jam-packed nature of Mulwes and the population,
The
Lagos,
commercial,
and then even in other public places where people are gathered, it's also a means of transmission to have the aerodrop
form of it, mode of it.
yes.
Yeah.
So sometimes it's airborne.
Yeah.
You could get it from that source too. So that's why it has to be the rats, which are the primary sources, must be properly
Eliminated. Yeah.
from where humans are.
Yeah,
So
and where foods are, because that brings me to hotels, restaurants, and the rest. Their storage facilities too. How many times do we have the health inspectors, going there to inspect how how hygienic, the places are where they cook for the public? Nobody is looking at that at all. And somebody said to me, if you want to know a good hotel, you go through the kitchen. So,
well, in view of what is happening now, a lot of people are more cautious. People are taking precautions and considering the fact that it's from food source.
Yeah, because we don't have the privilege of seeing their kitchens and the rest. So the hotels and the fast foods and the rest, they come in different grades anyway. And you can imagine if such a place is unkempt and the rest, and the rats have a field day there.
Free access to what they. Well, as we said, health promotion is key. We need to keep also telling those kind of the hotels and other sorts of food outlets. It's not just hotels, the Mr. Bigs, the Tantalizers, and the Swiss.
You're advertising these people on my site. You're going to pay. I'm going to send
I'm not.
I'm going to send a bill to the Nigerian Medical Association.
They should also sit up and ensure that there is proper hygiene of processing foods that are being sold to their customers. So I'm using your platform to send the message to Nigeria.
All right.
So you should pay me for that.
Hello, good morning. Hello.
I'm there. Hello.
Okay, go on. I thought was a caller.
Hello, good morning.
Was trying to reach us. Yeah. So such eateries
Hello, good morning.
must really be looked into very well.
Yes, we need to have health inspectors
Hello.
going around. And if they were doing it, probably monthly before, they need to increase the number of times.
Hello.
Now, and also
good morning.
increase the measures in place in those places, not just to visit, to ensure that proper higher levels of hygiene are sustained.
It's really been ages that are not seeing such people, the health inspectors. In those days, we used to have what they call wole wole, growing up on the Lagos Island. Do you see them again?
Yes. Well, the health inspectors may not,
maybe they call them inspectors. Probably they are generals now.
Because I remember sometime sometime last year, we had this dilapidated generator house, and somehow because of rains and everything, it collapsed. So I had some people came to see, and they were like, we should ensure we didn't.
Hello, good morning. Sorry, I think we'll have a caller. Dominic is calling from Calabar. Dominic, good morning.
Good morning.
Yeah. So tell us, what are your thoughts? Good morning. I can hear you loud and clear. Tell us, what are your thoughts on this Lassa fever outbreak and how prepared are we? What's the situation in Calabar, the capital of Cross River State?
Okay. I wanted to ask the doctor some questions.
Okay,
because from what he tried to say, it's like this sickness, this particular fever or virus comes up spontaneously from different states, and you are saying it has gone about 19 states by now. The question I wanted to ask: where has this virus been before now? That the thing is just coming up this way now, and looking at the way Nigeria attacked Ebola virus, I don't think that we are doing much to be able to combat this particular virus, because as of now, about 40-something casualties have already been recorded in the whole issue.
Okay, thank you very much, Dominic. Doctor, you're heading very well.
Yeah, I heard it clearly.
So,
You see, the fact that
So what are we really doing to be able to tackle it?
the Ebola last year had more of international
collaboration.
No, the impact
Yeah.
was more of international.
Yeah, it was
So
pandemic.
that
Yeah.
even at some point, flights to Liberia and Sierra Leone were stopped, considering the widespread nature and the fatality in those regions.
Yeah.
Now, we are having this happening locally in Nigeria. Yes, we have events, similar incidences in some other West African countries, but it's not as it was.
Okay, sorry, doctor. I'll just. Oh, okay, go on.
Now, we can't say that nothing is being done as compared to the Ebola.
Okay.
Because as it is, the same measure we used during the period of Ebola. The fact was that when Ebola occurred, and
we were taken unawares.
We
never prepared that.
Yes.
Oh, Liberia or Sierra Leone, Guinea, they are far from Nigeria.
When Ebola occurred, we put measures in place, and those measures were similar to what we have. We started educating people. Public enlightenment program was done on it, and in addition to that, where anybody suspected to have it, they had a particular IDH in Lagos where they are kept.
Okay, just a moment. I got Khalid. Khalid is calling from Katsina. Good morning, Khalid, and welcome to Core Digest. Hello, Khalid. Are you with us?
Hello, good morning.
Yeah, good morning, Khalid.
Yeah, concerning the LASSA bill, I want to ask some questions, please.
Can you please speak
Can you hear me?
louder? Can you speak louder, Khalid?
Hello?
Can you speak up a little louder, Khalid?
Okay, I want to confirm some things concerning
Well, I think we've lost him. So please go on, explain the pandemic then, of the Ebola and what we are having now with the Lassa fever. Don't forget that they share both similar, symptoms.
In terms of what is happening now started from rural aspects of the country.
Yeah.
And
Go on, please.
by the fact that it started from those regions, before the awareness that this is a Lassa fever case, the person probably was misdiagnosed and had passed on. That's why we have such number of deaths. But in the case of Ebola last year, the first of what was found in Nigeria, who came in from Liberia then, and then was trying to move to Port Harcourt, but because he had symptoms, he was in Lagos, and the hospital where he was able to say this is, and we're not allowing. He was planning to leave, still leave, but they held him down, and all that ensued from there. And those who had contact with him in the hospital primarily were majorly the ones in Lagos, and probably even the whole country eventually, that had the condition, and those who were having contact with them. So the primary source then immediately was arrested. Now in Nigeria, now we have this happening in different states at the same time. The rodent, which is the host, somebody asked earlier, where is it coming from now? The rat has been there, and these are the reservoir of this infection. They've always been there, but probably now they are coming closer to humans, and they are having more contact with humans, and humans are having contact with their feces and other forms of excreta. So by the time that happens, maybe they come on the bed of the patient, of the individual, and the individual still comes probably with some abrasions on some part of the skin and has contact with that. We just say, oh, the rat slept on my bed and left. You understand? So the person initially may take it with some degree of laxity and not know that this is a serious
matter.
But following that, people are now hearing that rats now are not your friends. You get it? People eat rats. You understand? I'm not sure a particular part of the country used to eat bats or monkeys, who are the primary reservoirs for the Ebola. You understand? that is primarily not our culture in Nigeria. But people eat rats. So those who may have eaten mistakenly rats that were already infested with the LASSA virus.
So it's not a matter of how long you cook it and the rest, Some people trying to cook.
Once you eating, it's been said that eating also is a source of.
Yeah, because some people want to console themselves to say, once the fire has eaten, that there is nothing.
That is not the case.
That is just
even when you.
That's been on a suicide mission.
Even before eating it, you would have processed it. I'm sure the person wasn't cautious to the extent of wearing gloves to handle it.
Even if then you'll be putting on a face mask
too, you see. So it's like this now, but I'm sure ever since those initial cases were infected and the information was and the cases were reported, ever since then measures have been stepped up to guard against further transmission to other people and the spread. So that's what is happening now, and that's part of why we are here, to ensure that more Nigerians are aware of Lassa fever is in the country. We need to take measures. We need to ensure proper, adequate personal hygiene and environmental hygiene. We need to ensure we ward off all rats. We need to ensure that your food, any kind of food, even the bread packaged in nylon, don't just leave it on your table. If you have a case, a place where you can, because once that rat eats from it, some people may not know. They may think, he has eaten from this part. Let me eat from that part. No. You understand? You never can tell what other part it has touched. I didn't eat. So once you eat it, you may likely get infected. So it's important that we realize that we should package our food very well and dispose of what is suspected to have been eaten by these rodents. Also, we prevent the rodents from coming close to our homes by having various means of eliminating them. And advent that somebody who you suspect to have anybody having any form of fever and all these other symptoms, general malaria, should report to the hospital, and proper measures will be taken from there, rather than do self-medication or medication in the house.
Report any case of any suspicious outbreak surrounding, the issue of the Lassa fever. If you feel nausea unduly, hemorrhage, from the nose, or you have what you call conjunctivitis, Apollo, just go seek immediate medical attention, and of course you'll be taken good care of. Well, we've looked at all the pros and cons of Lassa fever outbreak. How prepared are we? And together it's been with Dr. SEGUN AKINWOTU. He's the second vice chairman, Nigerian Medical Association, Lagos branch, and as well as a senior registrar with the Neuropsychiatric Hospital in Yaba, Lagos. Thanks so very much for having you again after over a year, of being on this program. I hope we'll see more. I hope we'll see more of you, to discuss a lot of health issues.
No problem, sir. Thank you very much for that.
Well, that's been our program today. I'm sure we're going to get it right with the telephonic system when we come your way again tomorrow and looking at another huge topic on Core Digest. But let's thank all our teaming viewers within and outside Nigeria for keeping faith with us and keeping a date with us. My name is Christian Ogodo. Thanks for watching. Bye-bye.
You can now watch Core TV News live from anywhere in the world on our website www.coretvnews.com. Click on Live TV on our website and watch us live.
And welcome to Core TV Primetime Days.
To follow us on Twitter, click on Twitter icon on our website. On Facebook, click on the Facebook and YouTube to see all our previous news production. You can also watch us live on YouTube. Click Core TV, leave a space, then News. Core TV News, a 24-hour news station.